Uh-oh, guess what day it is? Guess what day it is? Huh? Mike, what day is it, Mike?
Hello, I'm Michael Andrew Weston, and welcome back to Hump Day Health Talk. Today, I have the pleasure of sitting with what I'm going to call, I said I was going to say America's doctor, but I'll say Cleveland's doctor, Dr. Brown. I am so excited to have you. Can you just talk a bit about, why it's so important for us to look at cancer as men?
In terms of Americans, cardiovascular disease, of course, is the leading cause of death in Americas. So we're talking about heart attacks and stroke. But the second most leading cause of death in America is cancer. And so the most common cancers among men are lung, prostate, and colon. Fortunately, for all of those, we do have screening exams. The earlier that we find these malignancies, the easier the treatment is on the patient, the less expensive it is, and the quality of life can be completely improved because of finding something early. The outcomes are so much better, and the treatment is so much easier.
You said it, and I really would love for you to emphasize that some more, that it's important for early detection, for us to make sure that we're getting screenings, early detection if there is something, because it's also cheaper.
And, of course, people become afraid of the word cancer because they associate it with suffering and death.
Yeah.
And yes, that can be the outcome if it's found late. But the whole purpose of doing regular screening exams, as well as we'll talk about lifestyle things, is that we can find this at the earliest possible stage. So, for instance, for colon cancer always starts off as a small polyp. Doing a colonoscopy, an exam where an instrument is passed into the colon, you can look and see if a polyp is found. It can be removed at the same time. The whole procedure takes less than 30 minutes. Mm-hmm. Prostate cancer for men, it's a simple blood test. You don't, a lot of us worry about the digital exam and how that's going to feel, but it's a simple blood test. If the blood test is abnormal, then there's a whole range of options that we can use in order to how we're going to work this up and treat this.
Now, in terms of the screenings, you talked about lifestyle things, and I want to get to that in a minute, but I also want to find out, do these cancers impact certain populations, or are there other factors to consider around who is at higher risk, maybe?
For prostate cancer, Black men have the highest incidence in this country. We have the highest incidence of cancer among white males, Asian males, Latin males, white males.
Wow. So while we're looking at this, across these different types of cancers, right, what can we do to be preventative in nature?
Right now, 1 of 2 men are going to have cancer in this lifetime. Trying to watch your diet, to exercise, to actually try to not smoke, not alcohol. And one of the biggie things is sugar. Cancers love sugar. The more sugar you have, the more acid your blood is, and that promotes the growth of cancer. And also, I look at you, you've got a perfect weight, keeping one's weight down, because more adipose tissue is also associated with colon cancer and prostate cancer. If you're watching your diet, carry your food. When you leave home, pack your snack bag.
Yeah. And it requires you to be proactive.
Yeah.
And I think all of this that we've been talking about and everything that you've said today just screams be proactive.
Yes.
Right? Be proactive. Watch your diet, all these things, but also get the screenings. Do you have any other suggestions to people who are just, and we talked about this, they're just this ominous fear of having cancer? What would you say to somebody who's facing this?
So there have been a number of studies that have shown how your attitude and your mindset affects your immune system. Fear, worry, anger, resentment are not the attitudes that promote wellness and health.
If you've never heard a mic drop, you just heard one. Dr. Brown, thank you so much for spending this time with me. It's been a
pleasure.
pleasure speaking with you. And I know it's been a pleasure for you to enjoy this conversation. Thank you again for joining us, and we'll see you next time on Hump Day Health Talk.